Welcome to today's video about hidden warning signs of kidney failure in your feet. Your feet are speaking to you right now. They're sending urgent signals about your kidney health that could save your life. But most people ignore these warnings completely. What if I told you that the swelling in your ankles, the tingling in your toes, or even that persistent itching could be your kidneys crying for help? Today, we're uncovering 7 toxic warning signs of kidney failure that appear in your feet, signs so subtle that even doctors sometimes miss them. Over 37 million Americans are living with chronic kidney disease, yet 9 out of 10 don't even know it. They walk through life completely unaware that their kidneys are slowly failing, believing that as long as they urinate normally, everything must be fine. But here's the terrifying truth. Your kidneys can lose up to 90% of their function before you feel truly sick. By then, it might be too late to reverse the damage. That's why your feet become your early warning system. They're the canaries in the coal mine of kidney health. Research published in the Journal of Tissue Viability revealed something startling. Patients with chronic kidney disease consistently show significant problems with their feet that directly impact their quality of life. This isn't just about comfort. It's about survival. The same blood vessels and nerves that keep your feet healthy are intimately connected to your kidney function. When your kidneys struggle, your feet suffer, and recognizing these connections could be the difference between catching kidney disease early and facing dialysis or transplant. But there's something even more disturbing that most people don't realize. The very symptoms that appear in your feet aren't just warning signs. They're predictors of how rapidly your kidney disease will progress. Each swollen ankle, each numb toe, each color change in your skin is telling you exactly how much time you have left to act. So pay attention, because your feet are about to reveal secrets that could change everything about your health future. All right, let's dive into the list of hidden warning signs of kidney failure in your feet, starting with number 1. Persistent foot and ankle swelling. You know that feeling when you take off your shoes at the end of a long day and notice your feet look puffy? Most people blame it on standing too long or eating too much salt. But what if that swelling is actually your kidneys sending you a desperate distress signal? Edema, the medical term for this swelling, occurs when your kidneys can no longer properly filter excess fluid and sodium from your blood. Research from the American Kidney Fund shows that kidney-related edema typically appears first in the feet and ankles due to gravity's effect on fluid retention. Your kidneys normally maintain a delicate balance between the fluid you consume and the fluid you eliminate. When kidney disease develops, this balance collapses. Sodium accumulates in your bloodstream, forcing your body to retain water to dilute the excess salt. This extra fluid has to go somewhere, and it pools in the lowest parts of your body, your feet and ankles. What makes kidney-related foot swelling particularly dangerous is its persistence. Unlike swelling from injury or temporary salt intake, kidney disease edema doesn't disappear overnight. It progressively worsens, creating what doctors call pitting edema. When you press your finger into the swollen area, it leaves an indentation that remains for several seconds. This isn't just uncomfortable, it's a sign that your kidney function has already declined significantly. The progression is insidious. It starts with your shoes feeling slightly tighter at the end of the day. Then your socks begin leaving deep impressions on your skin. Eventually, the swelling becomes so severe that it extends up your legs, and your skin becomes stretched, shiny, and prone to breakdown. Once you reach this stage, your kidneys are likely functioning at less than 30% of their normal capacity. Next, warning sign number 2, numbness and tingling in feet. But here's where kidney disease becomes truly sinister. It attacks your nervous system in ways that most people never connect to kidney problems. Uremic neuropathy affects between 60 to 100% of patients with advanced kidney disease, according to research published in the Brazilian Journal of Medical and Biological Research. When your kidneys fail to filter toxins properly, these waste products accumulate in your bloodstream and poison your nerves. The process begins quietly. You might notice occasional tingling in your toe, perhaps a slight burning sensation in your feet at night. Many people dismiss these symptoms as signs of aging or blame them on diabetes. But what's actually happening is that uremic toxins are systematically destroying the protective covering around your nerve fibers, starting with the longest nerves first, those that reach your feet. Studies using nerve conduction testing reveal that 70% of patients with chronic kidney disease show evidence of peripheral neuropathy even when they report no symptoms. This silent neuropathy is particularly dangerous because it robs you of your ability to feel injuries. Imagine stepping on a nail or developing a pressure sore and having no idea it happened. Without proper sensation, these minor injuries can become life-threatening infections. The neuropathy follows a predictable pattern of destruction. It begins in your toes and gradually spreads upward, affecting your ability to balance, walk, and perform daily activities. Your reflexes disappear, starting with your ankle reflexes and progressing upward. Eventually, the numbness becomes so severe that you lose all protective sensation in your feet, setting the stage for amputations that could have been prevented with earlier kidney disease detection and treatment. Wait, because what I'm about to tell you about the third warning sign will shock you. Most people experiencing this symptom blame everything except their kidneys, missing a crucial opportunity for early intervention. The pain in your feet that you've been attributing to age, arthritis, or poor shoes might actually be your bones crying out because of kidney disease. Next, warning sign number 3, chronic foot pain and gout attacks. Your kidneys do far more than just filter waste. They're master regulators of your bone health. When kidney disease develops, it triggers a cascade of hormonal changes that literally rob your bones of their strength, causing a condition called renal osteodystrophy. This bone disease affects up to 90% of patients with advanced kidney failure and often manifests as persistent foot pain. Research published in the KDIGO Clinical Practice Guidelines reveals that kidney disease disrupts your body's ability to metabolize calcium, phosphorus, and vitamin D. Your failing kidneys can't convert vitamin D to its active form, leading to calcium deficiency. To compensate, your parathyroid glands go into overdrive, pulling calcium directly from your bones to maintain blood levels. The result? Your bones become weak, brittle, and painful, particularly in weight-bearing areas like your feet. But there's another mechanism at play that makes foot pain even more sinister in kidney disease patients. Your kidneys are responsible for filtering uric acid from your blood. When kidney function declines, uric acid accumulates, forming needle-sharp crystals that deposit in your joints. This creates gout, and the first joint affected is usually the big toe, causing excruciating pain that can make walking impossible. The relationship between kidney disease and gout is bidirectional and vicious. Studies show that 1/3 of all chronic kidney disease patients develop gout, while having gout increases your risk of developing kidney disease by 40%. The uric acid crystals don't just cause pain, they cause inflammation that further damages your kidneys, creating a downward spiral of kidney function decline and worsening gout attacks. The bone pain from kidney disease is different from typical arthritis or injury pain. It's often described as deep, aching, and constant, worsening at night and not responding well to typical pain medications. This pain represents the breakdown of your skeleton's structural integrity, a process that's often irreversible once advanced kidney disease develops. Next, warning sign number 4, skin color changes in feet. Now we reach perhaps the most visually striking warning sign, changes in your feet's skin color that reveal the hidden war happening inside your blood vessels. Chronic kidney disease and the conditions that cause it, particularly diabetes and high blood pressure, wage a devastating attack on your circulation that becomes visible in your feet long before you feel sick. The same vascular disease that damages your kidney's filtering units also destroys the blood vessels in your feet. Research demonstrates that peripheral arterial disease occurs in up to 40% of patients with chronic kidney disease, creating a spectrum of color changes that tell the story of your circulatory system's collapse. Poor arterial circulation causes your feet to appear pale or white, while inadequate venous return creates a dark, ruddy appearance. When circulation becomes severely compromised, your toes may turn blue, a sign that oxygen delivery has become critically inadequate. This isn't just a cosmetic issue, it's a medical emergency indicating that tissue death is imminent. If circulation continues to deteriorate, areas of your feet may turn black, indicating gangrene that will require amputation to save your life. But the color changes aren't limited to circulation problems. Kidney disease also affects your skin through a process called hyperpigmentation. High phosphorus levels, common in kidney failure, cause intense itching that leads to scratching and subsequent darkening of the skin. This creates a mottled, discolored appearance on your feet that many people mistake for age spots or harmless skin changes. The progression of color changes in kidney disease follows a predictable timeline. Early kidney disease may show subtle circulation changes. Perhaps your feet take longer to warm up or look slightly paler than usual. As kidney function declines, these changes become more pronounced, with distinct color differences between your feet and legs. By the time black areas appear, indicating tissue death, your kidneys are usually functioning at less than 15% of normal capacity. Here's something that will make your skin crawl. Literally. The next warning sign is so miserable that patients describe it as torture, yet it's one of the most overlooked symptoms of kidney failure. Next, warning sign number 5, severe itching of feet and ankles. Imagine an itch so intense that it keeps you awake at night, so persistent that you scratch until you bleed, so maddening that some patients consider it worse than pain. This is uremic pruritus, kidney failure-related itching that affects up to 90% of patients with advanced kidney disease. Your feet, with their thicker skin and constant contact with shoes and socks, often bear the brunt of this torment. When your kidneys fail to filter phosphorus properly, this mineral accumulates in your blood and deposits in your skin. High phosphorus levels trigger inflammatory responses that cause intense itching, particularly in areas with thicker skin like your feet and ankles. The itching typically worsens at night and after dialysis treatments, creating a cycle of scratching that leads to skin breakdown and infection. But phosphorus isn't the only culprit. Research published in multiple nephrology journals shows that uremic toxins, the waste products that healthy kidneys would normally eliminate, accumulate in your skin and trigger nerve endings responsible for itch sensation. These toxins literally poison your skin from the inside out, creating an itch that no amount of scratching can relieve. The psychological impact of this itching cannot be overstated. Studies reveal that kidney disease patients with severe itching have significantly higher rates of depression, sleep disorders, and decreased quality of life compared to those without this symptom. The constant urge to scratch creates a vicious cycle. Scratching provides temporary relief but damages the skin, leading to more itching and increased infection risk. What makes foot itching particularly dangerous in kidney disease was the decreased sensation from neuropathy combined with poor circulation. Patients scratch without realizing they're creating open wounds, and these wounds heal poorly due to compromised blood flow. Simple scratches become ulcers, ulcers become infections, and infections can lead to amputations in patients whose immune systems are compromised by kidney disease. Next, warning sign number 6, restless leg syndrome. Just when you thought kidney disease couldn't make life more miserable, enter restless leg syndrome, a neurological nightmare that affects up to 60% of patients with advanced kidney disease. This isn't simply feeling restless. It's an overwhelming, irresistible urge to move your legs and feet, particularly at night when you're trying to sleep. The exact mechanism behind kidney disease-related restless leg syndrome isn't fully understood, but research suggests it's related to the accumulation of uremic toxins that affect neurotransmitter function in your brain. These toxins disrupt the normal balance of dopamine and other chemicals that control movement, creating sensations that patients describe as crawling, burning, or electric shock-like feelings in their feet and legs. The timing of restless leg syndrome and kidney disease is particularly cruel. Symptoms typically worsen in the evening and at night, precisely when your body needs rest to recover from the stress of kidney disease. The constant need to move your legs makes sleep impossible, creating a cascade of problems including fatigue, depression, and worsened kidney function due to poor recovery. What distinguishes kidney disease-related restless leg syndrome from other causes is its severity and resistance to typical treatments. Standard medications often don't work as well in kidney disease patients, partly because many drugs are eliminated by the kidneys and can accumulate to toxic levels in patients with kidney failure. This leaves patients trapped in a cycle of sleepless nights and exhausted days. The relationship between restless leg syndrome and kidney disease progression appears to be bidirectional. The syndrome worsens as kidney function declines, but the sleep disruption and stress it causes may also accelerate kidney disease progression. Studies show that kidney disease patients with restless leg syndrome have higher mortality rates and faster progression to dialysis compared to those without this complication. Next, warning sign number 7, poor wound healing on feet. The 7th and perhaps most dangerous warning sign is your feet's inability to heal from minor injuries. This represents the convergence of all the previous problems: poor circulation, neuropathy, compromised immune function, and altered metabolism, creating a perfect storm for catastrophic complications. In healthy individuals, minor cuts, scrapes, and pressure sores heal within days to weeks. But in kidney disease patients, these same minor injuries can become life-threatening ulcers. Research shows that patients with chronic kidney disease have significantly impaired wound healing due to multiple factors, including decreased growth factor production, altered collagen synthesis, and compromised immune function. The process typically begins with a minor injury that goes unnoticed due to neuropathy. Without proper sensation, patients don't protect the injured area, leading to repeated trauma. Poor circulation means inadequate oxygen and nutrient delivery to the healing tissue, while high blood sugar levels in diabetic kidney disease patients create an environment where bacteria thrive. The statistics are sobering. Foot ulcers occur in approximately 25% of chronic kidney disease patients, and these ulcers have a 50% chance of becoming infected. Once infection sets in, the compromised immune system of kidney disease patients struggles to fight it off. What started as a minor scrape can progress to bone infection, requiring amputation to save the patient's life. The inability to heal also extends to surgical wounds. Kidney disease patients who require foot surgery face significantly higher complication rates, longer healing times, and increased risk of wound breakdown compared to patients with normal kidney function. This creates a vicious cycle where foot problems require intervention, but the interventions themselves carry high risk of complications. Your feet are speaking. Are you listening? These 7 warning signs: persistent swelling, numbness and tingling, bone pain and gout, color changes, intense itching, restless leg syndrome, and poor wound healing represent your kidney's desperate attempts to communicate their failing health through your feet. Each symptom represents a different aspect of kidney function decline, from fluid regulation to toxin elimination to bone metabolism. The tragedy is that by the time these symptoms become obvious, significant kidney damage has already occurred. However, early recognition and intervention can still make a tremendous difference. Research consistently shows that patients who receive early treatment for kidney disease can slow or even halt disease progression, avoiding dialysis and transplant in many cases. If you're experiencing any combination of these symptoms, don't wait. Schedule an appointment with your healthcare provider immediately. Simple blood and urine tests can reveal kidney disease years before you feel sick. Early detection gives you options: dietary changes, medications, and lifestyle modifications that can preserve your kidney function and prevent the devastating complications we've discussed. Remember, your kidneys don't send you a letter when they're in trouble. Instead, they speak through your feet, your skin, your bones, and your nerves. The question isn't whether your kidneys are trying to communicate with you. It's whether you're listening to what they're desperately trying to tell you. If this video was helpful, kindly type yes in the comment. That motivates us to produce more content like this. Don't forget to like this video if it provided valuable insights into kidney health. Share it with family and friends who need to know these warning signs, and subscribe to our channel for more life-saving health information. Thank you for taking the time to learn about these crucial warning signs. Your kidneys and your feet will thank you for paying attention to their silent cries for help.